Good afternoon, and thank you for joining us for this year's virtual benefits fair. We're looking forward to providing you with a lot of helpful information. My name is Erica Campo. I'm Congresswoman Wexton's district director, and we're pleased to have guests from VICAP and from the Social Security Administration. So to kick off today's benefits fair, we're going to kick it over to a message from Congresswoman Wexton. It appears we're having a little technical difficulties, so we'll try and get that patch back in a little bit. In the meantime, I wanted to kick it over to our guests to introduce themselves. We can start with David.
Well, hello, everyone. My name is David Melton. I am a public affairs specialist working for the Social Security Administration here in the Washington metropolitan area. I want to thank Congresswoman Wexton and her staff for this opportunity to spend the next hour with you as we talk about Social Security.
Thanks, David. Mary Lou?
Hi, I'm Mary Lou Wilkins. I coordinate the Loudoun County VICAP program, which is a Medicare counseling program. I've worked for the Area Agency on Aging here in Loudoun County for a lot of years. And I look forward to, talking about some Medicare topics that are often questions that we get in the office. Thank you. It's good to be here on a nice Friday.
Thank you so much to both of you for joining us. Working in the district office, myself and our caseworkers hear from constituents all the time with questions about healthcare, Social Security, Medicare. So this is definitely well needed, and we have lots of questions that have been pre-submitted that we can cover after your presentations. David, if you'd like to get started with your presentation, we can start with you.
All right. Thank you, Erica. And with the help of Justin, I'm going to share with you some PowerPoint slides today. And as we begin, we talk about Social Security with you through life's journey, securing today and tomorrow. And as I know you are aware, Social Security is a program of social insurance, paying retirement benefits, disability benefits, and survivor benefits to thousands of 10th Congressional District residents. And it's an important part of all of our lives. Today, we're going to focus on the Medicare aspect of Social Security. And Mary Lou and I are going to share information with you that I hope you find is concrete, useful, and actionable information that you can take away and incorporate into your planning for yourself and family members as appropriate. So Justin, if we'll move forward to the next slide, what I'd like to do is just to share with you that Medicare has 4 parts: Medicare Part A, Part B, Part C, or Medicare Advantage plans, and Medicare Part D. And Mary Lou is going to go into more detail about these parts of Medicare, but as you can see, there is original Medicare comprised of Medicare Part A hospital insurance. We pay a Medicare tax on our earnings of 1.45%, buying that Medicare Part A coverage during our working years. For most of us who are eligible for Social Security, Medicare Part A will be without premium. There's also Medicare Part B medical insurance, which does have a premium, and we'll talk about those premiums in more detail in just a moment. People with original Medicare may oftentimes add Medicare Part D drug plans and purchase supplements to help cover some of the out-of-pocket expenses under Medicare's Part A and Part B. There is also Medicare Advantage plans where you become part of a network of providers. So again, Mary Lou is going to discuss those aspects of Medicare in a moment in more detail, but I point out that there is information available to you at medicare.gov. Social Security's role with Medicare is twofold. We serve as your point of contact to enroll in Medicare Part A and or Medicare Part B. If you are a Medicare or if you are a Social Security beneficiary and have Medicare coverage, we will withhold that Medicare Part B premium out of that Social Security payment. So Justin, let's move forward to the next slide. And I want to talk about Medicare eligibility. And I draw your attention to 12 o'clock, the box labeled age 65. For many of us, Medicare is an age 65 issue, but there are other individuals who are Medicare eligible. And as we move clockwise on this slide, you will see that those may include individuals with amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease. It may also include individuals who have kidney failure, end-stage renal disease. Medicare will assist with the cost of dialysis and kidney transplant services. Some individuals become eligible for Medicare because of an exposure to environmental health hazards and the onset of defined disabilities. And then lastly, Social Security disability beneficiaries after 24 months of eligibility become eligible for Medicare. The sole exception to that 24-month waiting period are for those individuals who were found disabled based upon a diagnosis of amyotrophic lateral sclerosis. So as I said, for many of us, Medicare eligibility is an age 65 issue. And if there's one thing that you take away from viewing this presentation, I hope that you will remember that approximately 3 months before reaching age 65, you will need to make Medicare enrollment decisions. That's not to say that you will enroll in Medicare necessarily. We'll talk about that in a moment. But you will be making Medicare enrollment decisions and choices at age 65. So let's move forward to the next slide and talk about what are some of those enrollment periods. And again, I draw your attention to 12 o'clock on this slide with the box labeled initial enrollment period. Each of us will have a 7-month initial enrollment period, a defined period of time on the calendar centered on our 65th birth month. The initial enrollment period begins 3 months before that birth month and ends 3 months after that birth month. And for many of us, during that initial enrollment period, we will take steps to enroll in Medicare. Original Medicare or those Medicare Advantage plans, our choice. But if you are working when you attain age 65 and you have health insurance through that current job, or you are attaining age 65 and you are covered by a spouse's employer's health insurance through their current job, then by law, Medicare is a secondary payer, your employer, your plan is a primary payer, and you are afforded what is called a special enrollment period. An opportunity to defer your enrollment in Medicare Part A and or Part B and wait until that employer health plan ends. Now, I want to make clear that when we talk about an employer health plan, that implies that there is current employment, either your own or a spouse's. So these special enrollment plans do not apply to individuals who take insurance with them into retirement. It is based upon someone who is currently employed. We'll talk about that in just a moment in detail. And then there are open or general enrollment periods. For Medicare Part B, as you can see on this slide, that enrollment period runs from January 1st through March 31st of each year, with the coverage starting that following July 1st. If you fail to enroll during your initial enrollment period, and you should have, and you wait until these general enrollment periods to enroll, for each full 12 months of late enrollment, your Medicare Part B premium is increased by 10% for each 12-month period. So let's move forward to the next slide. And let's talk about when your Medicare Part B coverage would become effective if you enroll during that 7-month initial enrollment period. And again, a good takeaway is 3 months before reaching age 65, I should make a Medicare enrollment decision. And if you choose to enroll in Medicare Part B, by doing so in the first 3 months of that 7-month initial enrollment period, the first 3 months before reaching age 65, your Part B coverage will begin the month you reach age 65. If you wait until your birth month to enroll, your coverage will begin the following month. If you wait until the month after your birth month, then the coverage does not begin for 2 months. And if you sign up in the last 2 months of that initial enrollment period, then your Part B coverage would begin 3 months after the month that you enroll. So again, it's important for you to know when to enroll in Medicare so that your coverage begins when you want it to start. So let's move forward to the next slide. As I mentioned previously, there are premiums for Medicare Part B. We all pay a monthly premium. This year in 2021, that standard premium is $148.50 per month for each Medicare eligible beneficiary. There are higher premiums for Medicare beneficiaries with higher incomes. This is referred to as an income-related Medicare monthly adjustment. That's somewhat of a mouthful. But the intent is that individuals with higher incomes can afford a greater portion of their healthcare cost. And as that concept relates to Medicare Part B and or Medicare Part D prescription drug plan premiums, you can see that there are actually 6 different premiums based upon what is called your modified adjusted gross income, or MAGI. And what is that modified adjusted gross income? That is your federal adjusted gross income from that federal tax return plus non-taxable interest income. And as you can see, for individual tax filers with a modified adjusted gross income of more than $88,000, there will be higher premiums. For couples filing joint returns with a modified adjusted gross income of greater than $176,000, there will be higher premiums. And as you look at the chart, you can see those income scales and the additional premium that is paid on top of or in addition to that standard premium amount. A general rule is that we're looking at your modified adjusted gross income from 2 prior tax years. So for example, your Medicare Part B and or Part D premium in 2021 would usually be based upon your 2019 federal returns. Now, there are what are called life-changing events which interrupt that 2-year look-back cycle. Those life-changing events may include your retirement. And so oftentimes when someone retires and becomes eligible for Medicare, initially the Social Security Administration will set up your premiums at that standard rate. We will then obtain your tax information from the Internal Revenue Service and make adjustments as needed. You're notified of that adjustment. And perhaps when you receive that notification, you will want to reach out to the Social Security Administration to report one of these life-changing events. You would also complete a Social Security form SSA-44, That form is available at Social Security's website, ssa.gov. So your Medicare premiums can adjust, can fluctuate during the time that you're Medicare eligible based upon those fluctuations in that modified adjusted gross income. So let's move forward to the next slide. I've mentioned Medicare Part D prescription drug plans. And I also mentioned that the role that Social Security plays is to serve as your point of contact to enroll in Medicare Part A, Part B, and to withhold that Part B premium from your Social Security benefit if you're receiving one. If not, Medicare, the Medicare agency will bill you for that premium. But there are Medicare prescription drug plans that are available to you on the open market. Mary Lou can talk about those in more detail, but I want you to know that the Social Security Administration is responsible for administering the Extra Help program, help for lower income Medicare beneficiaries to buy these drug plans. And so to qualify for Extra Help, you would reach out to the Social Security Administration. You can see that you can apply for this Extra Help online at sa.gov/extra help. So this can save individuals up to $5,000 per year in out-of-pocket expenses as it relates to your prescription cost. So it's a very valuable program. I encourage you to look at this in more detail at our website if this is something that you may be eligible for, or perhaps someone that you know, a friend or family member, could qualify. So again, Extra Help with Medicare prescription drug plan costs. Let's move forward to the next slide. Medicare applications can be filed online at our website, again, ssa.gov. You can file a Medicare only application. And one thing that has changed during the pandemic is the ability for individuals who perhaps signed up for Medicare Part A only at age 65 and deferred Part B because they were working, and now they've stopped working and want to pick up that Part B coverage. You can submit that application to us online by completing two forms. As you see listed here, the CMS 40B, the application for Part B, and the CMS L564, a form that is completed by both you and your employer to verify that you did in fact have that employer health coverage. So again, we want to make you knowledgeable that a lot of those actions can be done online at ssa.gov. Let's move forward to the next slide. Just share with you the Medicare website. The Medicare agency, the Centers for Medicare and Medicaid Services, or CMS, has the responsibility of administering the Medicare program, not the Social Security Administration. And so we invite you to visit their website. You can see on the blue navigational tabs that there is a wealth of information available to you there about Medicare, its coverage, its cost, information about drug plans and supplemental policies. So again, we encourage you to visit medicare.gov to learn more about those Medicare programs. And let's move forward to the last slide, I believe it is. And I just share with you today a facsimile of the Medicare card, and I highlight the fact that when you become a Medicare beneficiary, you will receive a unique Medicare beneficiary identifier, a claim number, if you will, that is unique to you, but no longer associated with the Social Security number. Your Medicare beneficiary identifier will be composed of letters and numbers, again, with no connection whatsoever to your Social Security number. So you should receive a card that looks like this, which may be a bit different from the older versions that you might be familiar with. And Justin, I believe that was the last slide. We could double check. Thank you, and I hope that's helpful. It's a lot of information in a short period of time, but Mary Lou's going to build upon that now.
Okay. Thank you. That was good, David. I always enjoy hearing you speak. I'm not a great speaker, but I'm going to give some information from my slides. So let me see if I can get my slideshow up. Give me just a minute. Slideshow. Okay. I hope you can see my slides. Erica, can you tell me if you see my slides?
Not yet.
Not yet. Okay, I don't know how have I lost? Justin, do you have my slides? Could you show my slides since they don't seem to see them?
Yeah, Justin can throw those up in just a minute.
Oh, wait. Maybe that's it. Can you see that?
Not yet.
It says Understanding Medicare. I see it on my screen.
Oh,
I'm not sure.
oh, there it is.
Okay. Okay, great. Again, my name's Mary Lou Wilkins. I work for the Area Agency on Aging in Loudoun County, and I coordinate the VICAP Medicare Counseling Program. VICAP stands for Virginia Insurance Counseling Assistance Program. That's what the Medicare counseling programs are called in Virginia. They are a part of the national programs called SHIP programs, State Health Insurance Assistance Programs. These are programs that get federal grants to provide Medicare counseling and assistance to Medicare beneficiaries all across the United States. There are 54 VICAP or SHIP grants, all the 50 states, also the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands all have Medicare counseling programs that originate from the SHIP programs, but each state or territory names their own program. So in Virginia, they named it VICAP, Virginia Insurance Counseling Assistance Program. I know that's a kind of a confusing. If they had one name nationwide, it would be much easier for us to let people know we're here, but that's what we're called. We offer free, personal, unbiased, confidential Medicare assistance to Medicare beneficiaries, their families, their caregivers. We do that over the phone or email during COVID, and we can see people face to face when we're not in an epidemic. We also use trained volunteers, counselors to extend our program. This is the card that David just showed. It's the Medicare card. When you're enrolled in Medicare, you will have that card regardless of if you're in a Medicare Advantage plan or original Medicare. If you're in a Medicare Advantage plan, you just won't use this card while you're in the Medicare Advantage plan. But let's go on. I brought 3 topics today. One of them is the Medicare open enrollment period, which is about to start. Second topic is, should I enroll in Medicare when I turn 65? I hear that question all the time. And the last one, I'm going to give a little bit of a comparison between original Medicare and Medicare Advantage. So the open enrollment period runs from October 15th, that's next week, through December 7th. And that's the time of year that everyone that uses a Medicare prescription drug plan, whether with original Medicare or in a Medicare Advantage plan, can change their coverage. You can choose to change your coverage for next year, for 2022. You have until the 7th of December to decide if you want to switch out of what you're currently in or enroll in something new. So this is the time of year that Medicare plans send out letters. If you currently are in a prescription drug plan, you probably have gotten a letter from your company saying what the changes are going to be for next year. And there will be lots of changes, both in premiums, drug copays, deductibles, everything changes from year to year. So if you have a Medicare prescription drug plan, you really need to look at it every year to make sure that that's still the best plan for you. They change, as I said just a moment ago, the Medicare drug plans change their costs, their coverage, whether they're supplemental coverage, prescription drugs, all of those things change from year to year. If you have your prescription coverage through an employer with a retiree plan, there's a huge caution here that I want everyone to remember. If you get your drug coverage through an employer retiree plan, you need to be very careful in looking at the Medicare drug plans. You do not want to enroll in a drug plan and perhaps that might kick you out of your retiree coverage. So you need to talk to your retiree benefits administrator before you make any changes during open enrollment for a Medicare drug plan. There are SHIP VICAP programs in every part of Virginia. They're administered through the area agencies on aging. So if you need help during open enrollment to find the best drug plan for you, you can call your local area agency on aging. Last year, no, actually in 2020, our VICAP program helped about 300 Medicare beneficiaries in Loudoun County save about $420,956 for this year's drug plans. So we helped them find a drug plan that would save them that much money. And the savings ranged from just a few dollars to thousands of dollars. So you really need to take a look to see if you need to change or if you could change to reduce your cost. If your plan is still low cost and still serving your needs, you don't have to change. But if you want to change, you have to do it by December 7th. Second topic is a question that we get all the time. Do I need to enroll in Medicare when I turn 65? And the answer is, it depends. It depends on your situation. So I'm going to go through 2 or 3 situations here and give you some information about whether that person should enroll in Medicare. So if it's a person who's turning 65, and as David said, they're covered by group work insurance through either their current work or their spouse's current work, and that employer has 20 or more employees, that's called a large employer, 20 or more employees, that insurance comes from that employer, and they plan to continue working and have coverage from that work insurance, then you do not need to enroll in Medicare when you turn 65. You can enroll in Part A because most people qualify for 0 premium for Part A. So you could just enroll in Part A and it would just sit there in the background. But you should most likely delay enrolling in Part B. And the reasons for that is that if you're currently working and have that insurance, it would be primary and Medicare would be secondary. And you would be paying a premium. If you signed up for Part B, you'd be paying a premium every month for an insurance that probably is not likely to ever pay. So it's important that you do not sign up for B. But the most important reason that I tell people for not enrolling in Part B when you're working is that when you enroll in Medicare Part B, that triggers a 6-month window when you can buy Medigap insurance at what's called guaranteed issue. That means that the Medigap companies who sell that insurance are required to sell it to you if you apply for it. They can't turn you down. They can't charge you higher premiums due to your health. In fact, they can't even ask you any medical underwriting questions. During that 6-month period, when you first get Part B, you can get Medigap at guaranteed issue. And if you signed up for Part B when you were working and didn't need it, then when you retire, you wouldn't have that 6-month window guaranteed issue again. You don't get that guarantee issue period ever again. So save that for when you retire and do need a Medigap plan to go with your Medicare. Okay, situation 2, person says, do I need Medicare when I turn 65? But they aren't working and they don't have a current work insurance. They may have a retiree insurance, but they don't have a current work insurance. So the answer to this person's question is yes, you need to sign up for Medicare when you turn 65. And as David said, you can start about 3 months before your 65th birthday. That's what we recommend to everyone. Start early. It takes a little bit longer than you think sometimes. You can have glitches, things can happen. And so start early, and it can start your birthday month. And of course, David gave the other, it can start a little bit later if you delay enrolling until the month of your birthday or 3 months after your birthday. But that's your initial enrollment period. If you're not covered by work insurance, yes, you need to sign up for Medicare when you're 65. Okay, here's a third situation. This person's turning 65 and they're working, but they want to sign up for Social Security benefits. And in order to receive Social Security benefits, a person, if they're eligible, they must sign up for Part A in order to get Social Security benefits. So in this situation, the person should apply for Medicare Part A, but still delay that enrolling in Part B. They don't need Part B, but if they're going to get Social Security benefits, they need to enroll in Part A. So those are just three of the situations of turning 65 and deciding whether you need to enroll in Medicare or not. Now comes a very complicated issue, understanding original Medicare and Medicare Advantage. When you enroll in Medicare, you are enrolled in the original Medicare. You get that red, white, and blue card, and you're in original Medicare, but you have a choice of changing to Medicare Advantage if that's what you want. Medicare Advantage are plans that are private insurance companies who have contracts with the federal government to provide Medicare benefits. And so when you enroll in Medicare, you get this red, white, and blue card. And if you stay with original Medicare, you don't enroll into Medicare Advantage, then you'll use that card when you go to doctors and hospitals and, to get your medical care. And your claims will go directly through the federal government. And it includes Part A and B, as David said. Part A is the inpatient hospital, and Part B is everything else, everything outpatient. And so I found a cute, interesting statistic. Across the United States, 93% of doctors take original Medicare. They will treat you and submit your claims. And 66% of hospitals. And the reason that's lower for hospitals is that veterans hospitals and military hospitals do not accept Medicare. But on the average, most doctors and regular hospitals take Medicare. Now, your second choice, if you don't go with original Medicare, is to enroll in a Medicare Advantage plan. And this is just an example of what that card might look like. It'll have the name of the company on it and some numbers and whatever. That'll be your card that you would use for your medical if you're in a Medicare Advantage program. Medicare Advantage programs, as I said previously, have a contract with Medicare, and they're supposed to provide you with the same benefits that you would get if you were in original Medicare. They may have different rules and regulations, but the benefits are supposed to be the same. Sometimes this is called Medicare Part C or Medicare Advantage. That's the same thing. A little confusing. Most Medicare Advantage plans have all of the services on one card. You use their one card to go to doctors, to hospitals, physical therapists, any kind of medical treatment. And you also use that card for drug coverage in most cases. It's built into one plan. There are 3 types of Medicare Advantage plans: HMOs, PPOs, and private fee-for-service plans. I'm not going into details on those now, but if you're going to sign up with a Medicare Advantage plan, you should check to see which type it is and exactly how that would impact your coverage, what that would impact how you would get your services. It's very important that you understand that. Okay, now some common things. Medicare Advantage and original Medicare have some things in common that are the same. So you still pay premiums, whether you're in Medicare Part Original Medicare or Medicare Advantage. You pay the Part A premium if you owe one. Most people get Part A without a premium, but everyone pays Part B premiums, and you pay that even if you're in a Medicare Advantage plan. Some people don't understand that, but that's one of the things that's in common. And again, as I said previously, Medicare Advantage plans and Original Medicare are supposed to cover the same services, all the same coverage. Medicare Advantage plans may have different rules, different appeal procedures, everything may be different with Medicare Advantage, but they're supposed to cover the same services. Both Medicare Advantage and Original Medicare cover a list of preventive services that you get for zero copay. Those came out a few years ago, and it's to keep people well rather than treat you after you're sick. So the preventive services are screenings so that you find any problems you have early. And both of those are at zero copays, both Original Medicare and Medicare Advantage. With Original Medicare and Medicare Advantage, if you need durable medical equipment, those are things like wheelchairs, walkers, oxygen, all sorts of medical equipment that you might need, you will pay a 20% copay for that with Medicare Advantage and Original Medicare. And if you need hospice care, that's always covered. Hospice is always billed through Original Medicare, even if you're in a Medicare Advantage plan. Now, some of the differences between Original Medicare and Medicare Advantage, those are the types: cost, provider access, all those things. Let's go through each of them separately. The cost. With Original Medicare, you pay $148.50, the Part B premium. With Medicare Advantage, you pay $148.50, and you may pay an additional premium. Some Medicare Advantage plans have additional premiums you'll be responsible for. With Original Medicare, there are deductibles for the hospital, Part A, and Part B. With Medicare Advantage plans, they may have what they call a health care deductible. You need to be careful and understand that some of them have quite large health care deductibles that you'll have to pay before the plan pays. With Medicare, after you get through the deductible, you have a 20% coinsurance. With Medicare Advantage plans, they have copays, and you always pay copays for every service, everything you have, there will be copays. With Original Medicare, Part D has deductibles, and with Medicare Advantage plans, the drug coverage may also have deductibles. Provider access is a major difference between Original Medicare and Medicare Advantage. If you have Original Medicare and you're using your red, white, and blue Medicare card, you can go to any provider anywhere in the United States that accepts Medicare and get services. You have great flexibility in choosing which doctors, hospitals, those sort of things that you use. Medicare Advantage, on the other hand, use networks of providers or facilities. So you're required to go to certain hospitals, certain doctors, labs, all those types of things they have to be in network. If some plans let you go out of network, but you pay a lot more, your copays are much, much higher. And some do not allow you to go out of network at all. HMOs, you can't go out of network, or you pay full retail, you pay full. So, and Medicare Advantage plans are regional. You have to get your services in a fairly small region, a couple of counties, maybe, Northern Virginia. And if you're traveling, that can be a problem. If you're traveling, emergency services are always covered, but non-emergency services are not. And what that means is if you need to go to the emergency room, you can go with Medicare Advantage out of network hospitals. It doesn't matter as long as it's an emergency. If you have something, you're traveling and you're out of your service area with a Medicare Advantage and you need to see a doctor, maybe you have a strep throat or something that's not a true emergency, but you need to see a doctor, you can only do that in your region, your network providers. And so that can be a problem if you spend time with children in other parts of the country or whatever. You can't get non-emergency services with a Medicare Advantage plan if you're outside their service area. And with original Medicare, you're not required to have a referral to see a specialist. With most Medicare Advantage plans, you do need a referral to see a specialist. Now, Part D drug coverage differences. With original Medicare, you sign up for a standalone drug plan and you get a separate card that you'll use at the pharmacy to get your drugs. They have deductibles. They can range, this year it's from $0 to $445 deductible. Next year, I think the deductible is $480. Medicare Advantage plans usually include the drug coverage, and you use that one card for drug coverage as well as your medical. And their deductibles are the same. They range from $0 to $445 this year. Again, I think next year it's $480. Another big difference is Medigap, which is supplemental insurance that helps you pay your out-of-pocket cost or your co-insurance cost. With original Medicare, you can buy Medigap insurance, and they help you pay after Medicare pays, and it reduces your out-of-pocket cost. Medigap plans are only used with original Medicare. You cannot use Medigap plans with Medicare Advantage, which means you always have a copay. You always have out-of-pocket to pay with Medicare Advantage plans. Other differences are related to benefits. With original Medicare at this point, now original Medicare does not cover vision, dental, or hearing unless they're medically necessary. But you can buy a private plan to cover them. Medicare will cover an eye exam if you need to see a doctor because you have cataracts, glaucoma, macular degeneration, anything like that, because that's a medical reason. But if you just need to see an eye doctor to get a new pair of glasses or contacts, that would not be covered by Medicare. Many Medicare Advantage plans do have basic coverage for vision, hearing, and dental, but you need to check that before you enroll in that plan. Make sure you understand what's covered and if there's an extra premium. Some of them charge an extra premium for those additional vision and hearing and dental benefits. They also, in Medicare Advantage, may include some other benefits, but sometimes be careful of those also. Sometimes you need to qualify in order to get those extra benefits with a Medicare Advantage plan. That means you have to have a certain diagnosis, a certain disease, something like that. And out-of-pocket limits. That's a difference. With original Medicare, there's no out-of-pocket limit. Out-of-pocket limit means once you reach a certain amount of money that you've spent, then your insurance pays 100% after that. Medicare does not have out-of-pocket limits, but you can buy a Medigap insurance, which will limit your out-of-pocket. For instance, if you buy a Medigap Plan G, your out-of-pocket limit with Medicare is $203 this year. That's the Part B deductible. That's the only thing you pay for Medicare-approved coverages in 2021 would be $203. With Medicare Advantage, there are out-of-pocket limits. They're required. They range, I looked them up for Loudoun County, they range from $3,400 to $11,300. That means you would have to spend that amount of money before your Medicare Advantage plan would pay 100% of the cost. And both of these, Medigap and Medicare Advantage, do not include the prescription cost in that maximum out of pocket. Okay, some cautions, some things to be careful about. Do not drop your Medigap plan until you are absolutely sure you're going to enroll in a Medicare Advantage and that's what you want to have. You may not be able to get that Medigap plan back. If you want to get it back, if you've been in a Medicare Advantage plan for a year or two and you want to go back to original Medicare and buy a Medigap plan, you'll have to undergo medical underwriting, answer a lot of medical questions, and the Medigap company can deny you. They can refuse to sell you a policy. So be careful dropping a Medigap plan that works for you. There are some trial rights with Medicare Advantage. Make sure you understand those and that your supplemental insurance has agreed that you are in a trial right period and you can get it back before you drop that Medigap plan. The other thing I want to note is there's a lot of advertising on TV, and I want to tell you to be very careful. Much of that advertising is very misleading, in my opinion. All those TV and radio ads make Medicare Advantage plans. Sometimes they make them sound like that's just a supplement to Medicare. It's just adding some benefits, and it's not. It's switching your benefits. You're replacing your Medicare with Medicare Advantage. It's not just adding benefits. And so be very careful. You can call your local VICAP program if you have questions about that. Some other things that I want to tell you to be cautious of are phone calls that you might get. There have been a lot of reported phone calls of unethical sales practices by some Medicare Advantage sales agents. They will call and say that your new Medicare card is ready and it includes all these new benefits. All you have to do is give them your information and they'll send you your new card. And you'll find out you're in a Medicare Advantage plan without even enrolling. Or they call up and say your Medicare card's about to expire and give me your personal information, your Medicare card number and that sort of thing, and I'll just enroll you. I'll make sure your card doesn't expire. Or anyone going door to door selling Medicare Advantage. That's against the rules. They should not be doing that. And unsolicited phone calls from any insurance agents are illegal. They're not allowed to do that. So now if you've signed up to get more information online or something you got in the mail or you called an 800 number, then they have permission to call you, but they cannot call you unsolicited. So those are becoming major problems. If you need help, have questions about Medicare, you can call your local VICAP. The number in Virginia to find your local VICAP is 800-552-3402. And then I put a few helpful websites. There's the Medicare.gov. You can trust any information you see on that website. There is a Medicare.com. Be very careful. Do not go to Medicare.com and trust their information necessarily, but Medicare.gov is a legitimate, site you can trust. So is the Social Security site. If you want to find your local SHIP program anywhere in the United States, maybe you have friends or relatives in other states and they don't have, they can't call their local VICAP, but they can call their local SHIP program. To find that particular program, there's a website, shiphelp.org. And I think that's the end of my presentation. Thank you so much.
Thank you, Mary Lou. That was very helpful, and David as well. You guys answered a ton of the questions that constituents already sent in to us, so thank you very much. And it looks like we have a couple minutes to kind of run through a few of the questions that weren't addressed. And just a reminder to folks at home, if your question wasn't addressed, it's likely a member of our staff will reach out directly to you with an answer or with more information. And you're always welcome to call our office, and you can find our contact information on wexton.house.gov. So our first question, I think, would be best addressed by David, and it is from John in White Post. He asks, I am 60 years old and plan to retire at 62. Are there step-by-step instructions for early retirement as opposed to full retirement age?
Well, I would share with John that I would want him to visit our website, ssa.gov, and use our retirement planners. We have planners for retirement scenarios, disability scenarios, and survivor scenarios. But when you look at those resources that are available, you will find a fact sheet that talks about your retirement checklist, that step by step, item by item, check off things that we believe are important for people to be doing. Erica, one of the things that we talk about at Social Security is learn, apply, and manage. And we work very hard to put those three sources of information and action into people's hands. So John is asking about, how do I learn? And I would just say one of the best ways to learn is to visit us online at ssa.gov or call us. We have a national toll-free number, 1-800-772-1213. Representatives are available to answer your calls from 8 a.m. to 7 p.m. Monday through Friday. Automated services are available 24 hours a day, 7 days a week.
Excellent. Well, similarly, Michael in Sterling mentions that he read Medicare 123 Made Easy by Ian and David Schaefer. And he said it was really helpful to him in understanding Medicare. Is there something similar for Social Security? Is there a book you would recommend, or do you think the website's still the best shot?
Yeah, I would certainly refer someone to our website. As Michael points out, there are a variety of resources out in the world. We don't recommend or refer people to any specific private publication. Some of those are very good. Others you may have to be cautious in using. But again, I think when someone has a question about Social Security benefits, the first place they should go for that answer is the Social Security Administration. And I really encourage people to visit our website and utilize those tools. Sign up for a My Social Security account. I know we haven't talked about this today, Erica, but we have just unveiled last weekend a new redesigned Social Security statement. People can access those new statements and see that information at socialsecurity.gov, ssa.gov. Either of those web addresses will work.
Excellent. Now, transitioning a little bit, we got several questions about Medicare coverage. Mary Lou, Claire in Ashburn asks, does Medicare cover any routine or preventative dental and vision care, such as annual exams, teeth cleanings or fillings, corrective lenses, etc.? And similarly, Cyrilla in Fairfax also asked about hearing aids covered by Medicare.
Okay. Currently, Medicare only covers, I'll do vision, dental, and hearing. They only cover vision for medical reasons. Dental, they will cover if you're in an accident, need dental reconstruction, something like that. But normal dental, as we think of going to get cleanings and fillings and that sort of thing, is not covered by original Medicare at this point. And hearing aids are not covered. If you have a medical reason to have an eye exam again or dental, then Medicare does cover it, but that's the limitation to it.
When you say medical reason, could you give us a little more? So it's basically not eye exams, routine
Right.
checkups.
If you need to see an eye doctor because you have a medical cataracts, glaucoma, macular degeneration, even something in your eye, something that you've had in your eye that you need to have taken out, that's medical. But if you just need to see an eye doctor to get a new pair of glasses, that's not medical. Medicare does not cover it. And the same with dental. If you need cleanings and fillings, that's not covered. But if you need reconstruction, if you've been in an accident and you need to have your teeth reconstructed, or if you have, cancer of the mouth or something, and you need to have some dental surgeon do something with your teeth, then that's medical and that's covered. But normal dental is not covered. Now, they're discussing this in Congress right now. So for now, it's not covered by original Medicare. And the ones with Medicare Advantage, the coverage they have, I do encourage people, check into those, make sure you understand how much coverage you're getting. Sometimes it's very basic. It's not what you would consider. We get calls from people who say, I signed up with that company and I thought I was going to get this and I got that. So make sure, that's just the main thing I would say. Make sure you know what you're signing up for before you change or before you, enroll in one of those or in anything, basically.
That is very helpful. Thank you. I think we have time for just a few more. Terry in Frederick County asks a question. David, I think this one would be for you, but both please chime in. Terry says, my brother receives Social Security and Medicaid. He's 63 years old. Will he have to sign up for Medicare at 65? And if yes, can he still qualify and keep SSI and Medicaid?
Erica, that gives me the opportunity to mention that we do at Social Security administer an assistance-based program called Supplemental Security Income, or SSI, pays benefits to approximately 8 million individuals around the country. So for someone who is SSI eligible, usually they will qualify for Medicaid from the Commonwealth of Virginia. At age 65, that individual would want to sign up for Medicare. The good news is that there are programs, I mentioned briefly that extra help as it relates to Medicare Part D drug plans. There are state programs, state assistance programs to help with Medicare out-of-pocket expenses, Medicare Part A, Part B, Part D perhaps for the extra help, but for Part B, the Medicaid program very well may pay for that Part B premium. So they would have both Medicare and Medicaid services with little to no out-of-pocket cost. Reach out to us in that particular question. I would want that individual to reach out to us 3 months before age 65 to make that Medicare enrollment action.
And call their local VICAP to find out if they need to get into a drug plan, because once they become eligible for Medicare, they would need to use a Medicare drug plan. Medicare would be primary, and so we would help them do that if they reach out to their local counseling program.
Excellent. Well, I think we have covered, I have one more real quick one. What is the COLA in 2022 for seniors?
Erica, stay tuned. We just ended the third quarter of the calendar year, and those statistics will be available. We anticipate announcing the 2022 COLA over the next few short weeks. So again, stay tuned. Check out our blog. You'll be the first to know.
Excellent. And I apologize for the train noise. I almost got through the hour without the train coming by. Thank you both so much for your time and all of your information. We really appreciate it. These are complicated topics. Please, to the constituents watching, take advantage of all of the resources that David and Mary Lou have discussed on the websites. And again, please don't hesitate to call our office anytime you have questions, can't find a number. Lena Westfall in our office, who many of you are already familiar with, handles all of these issues and would be more than happy to assist you. So thank you so much and have a wonderful Friday, guys.
Thank you.